I'm Dr. Hart, a GP in Bradford who's helped work on the referral pathway for the Rethinking Pain service. Welcome to this video talking you through the Pain Support Plan. The Pain Support Plan is an important tool in helping you support patients to develop a shared management plan, and its completion is mandatory before referral to Rethinking Pain. Patients have told us that having conversations about their experience of their pain is unique to them. They want to be able to tell their pain story to a healthcare professional and be heard. We know that patients with persistent pain can present multiple times, and you have told us consultations can feel difficult and frustrating for both them and ourselves. It can be hard for us as healthcare professionals to feel positive about these consultations. The Pain Support Plan has been developed to help patients prepare for each consultation, explain what their pain means to them, and their feelings and experiences of that pain. They can write down the things they've already tried and whether these have helped or not. Hopefully this will mean they come to the consultation feeling reflective about their own experience. This can help us understand more about the patient's experience with their pain and give more context into how that pain has affected their lives. It can be given to patients prior to further consultations about pain management with yourself, used during the consultation, and copies given to the patient to use before seeing other professionals, such as physios or social prescribers. The Pain Support Plan explains what options are available for people who live with pain every day and why developing non-medicalised care can improve their quality of life rather than relying on medication and surgical interventions that there is no current evidence for. This lays the foundations for the conversations we have with them about holistic support and self-management. The Pain Support Plan prompts patients to consider areas of their lives that they want to change. This can be overwhelming for them, so it suggests only changing one or two small things to begin with. The patient will write their proposed changes down. This includes looking at any actions they may be able to make that may help them improve their pain. It also prompts them to consider any possible barriers to achieving this and any practical changes they can make. This may be where we come in and can offer advice and support on how to make those changes or overcome those barriers. We then come to the sharing decisions part of the plan. Patients have told us that it is so important they are part of this process and not simply told what to do. It also puts the onus on the patients thinking about what may work for them rather than simply relying on medical intervention that we know is not optimal for most of these patients. You will see that there is a section for the patient to complete on the actions they will do, as well as one for the healthcare professional. The hope is that as you review the patient in the future, the patient will be doing more self-care and rely on you and the medical world less and less. It is important to safety net these patients. Firstly, this empowers them to manage on their own where possible, but it gives them the right advice on when to come back and who to see if needed. The plan ends with some resources at the bottom that you and the patient can use to understand and manage their pain. You can direct to the Rethinking Pain website for more, including relaxation and movement videos, peer support groups, and patient stories. The hope is that both you and the patient will leave these consultations feeling much more positive, knowing that you have both been listened to and have come to a management plan you have both agreed to.